Today we're going to talk about safety. This information can be found in Chapter 13 of your textbook. A safe setting is one where there is little risk of injury or illness. It's free of hazards to the greatest extent possible. And in a safe setting, teamwork is important. A hazard is anything in the person's setting that could cause injury or illness. For example, spills, loose handrails, or unanswered call bells. Teamwork refers to working together to correct safety hazards as soon as possible. If you can't correct an issue, you need to follow agency policy to report the problem. So for instance, electrical outlets that don't work, water leaks, or broken or damaged furniture. Some people cannot protect themselves. They present dangers to themselves and others. Children and older persons are at risk for injuries. Confused and disoriented persons may not understand what is happening to and around them. A coma can occur from illness or injury. Coma is a state of being unaware of one's setting and being unable to react or respond to people, places, or things. Agitated and aggressive behaviors can increase the risk for accidents. Pain can cause these behaviors, so can confusion, decreased awareness of surroundings, and fear of what may happen. Persons with vision loss can fall or trip over equipment. Some cannot read container labels and poisoning can result. Persons with hearing loss may not hear warning signals or fire alarms. Some cannot hear approaching meal carts, stretchers, or wheelchairs. They do not know to move to a safe place. Illness and aging affect smell and touch. The person may not detect smoke or gas odors. Burns are a risk from impaired touch. The person may have problems sensing heat and cold. Some people may have a decreased sense of pain. They may be unaware of an injury, such as a blister from their shoes. Some diseases and injuries affect mobility. Some persons cannot walk or propel wheelchairs. Some persons are paralyzed. And finally, medication side effects may include loss of balance, drowsiness, and poor coordination. Reduced awareness, confusion, and disorientation may occur, and those things increase a patient's risk for accidents. Paralysis is loss of muscle function, sensation, or both. Paraplegia is paralysis in the legs and lower trunk. Quadriplegia is paralysis in the arms, legs, and trunk. And hemiplegia is paralysis on one side of the body. Each person has different treatments, therapies, and activity limits. The wrong care can threaten life and health. ID bracelets or identification bracelets are used to identify the person before care is provided. Persons receive an identification bracelet when admitted to an agency. ID bracelets may include the person's name, ID number, room and bed number, date of birth, age, doctor, and medical record number. Before providing care, use at least 2 identifiers. Some agencies require the person to state and spell his or her name and give his or her date of birth. Others require using the person's ID number. You cannot use the person's room or bed number. It's important to call the person by name when checking the ID bracelet. In long-term care, alert and oriented residents may not wear ID bracelets. This information is noted in the care plan. Some nursing centers have photo ID systems. Taken on a mission, the photo becomes part of the person's medical record. So how should a CNA identify the person? You're providing care to Miss S. She is alert and oriented. She is wearing an ID bracelet. How would you identify her before providing care? The correct answer is to ask her to provide her name and date of birth and verify it with the ID bracelet. Beds, chairs, and wheelchairs and other medical equipment typically have a weight limit of 250 to 350 pounds. Bariatric equipment is labeled bariatric, EC for expanded capacity, or with the weight limit suggested by the manufacturer. A disaster is a sudden, catastrophic event where people are injured and property is destroyed. Natural disasters include tornadoes, hurricanes, blizzards, earthquakes, floods, and volcanic eruptions. Human-made disasters include auto, bus, train, and airplane accidents. They also include fires, bombings, power plant accidents, gas or chemical leaks, explosions, and wars. Healthcare agencies have disaster plans for caring for people needing treatment. These include discharging people who are ready to go home, assigning staff and equipment to an emergency area, assigning staff to transport persons from treatment areas, calling off-duty staff to work, and evacuation procedures if the agency is damaged. Elopement is when a person or resident leaves the agency without staff knowledge. CMS, or the Center for Medicare and Medicaid Services, requires that an agency's emergency preparedness plan address elopement. Agencies must identify persons at risk for elopement, monitor and supervise persons at risk, address elopement in the person's care plan, and have a plan to find missing patients or residents. Workplace violence it refers to violent acts directed toward persons at work or while on duty. OSHA has guidelines for preventing workplace violence for healthcare and social services workers. OSHA has identified the following risk factors for workplace violence: working with persons who have a history of violence, who have abused drugs or alcohol, are gang members, or are related to patients and residents, transporting patients and residents, working alone in an agency or person's home, working in a setting where a staff member cannot see or escape from danger or a violent situation, poorly lit hallways, rooms, and parking lots, lacking a way to communicate an emergency situation, working in areas with high crime rates, low staff levels during meal times and visiting hours, long waits, overcrowded waiting rooms, and unrestricted visitors. Burns are a leading cause of death among children and older persons. Smoke alarms on every level of the home, in each bedroom, and outside each bedroom or sleeping area are one way to prevent burns. Alarms should be tested every month. Batteries should be replaced when daylight savings time changes in the spring and fall. Alarms with flashing strobe lights should be used for hard of hearing persons. Do not leave children home alone. Supervise young children at all times. Do not leave children alone in the kitchen, bathroom, or a room with a fireplace. Install barriers around fireplaces, ovens, and furnaces. Store matches, lighters, or other flammable materials in locked cabinets. Teach children fire safety and fire prevention measures. Cover car seats with towels if you park in the sun. Protect children from sun exposure. Do not let children help you cook. Use the back stove burners when cooking. Point pot and pan handles away from where people stand and walk. Stay in the kitchen when cooking. Turn off the stove if you leave the kitchen. Keep towels, oven mitts, food packages, and curtains away from the stove. Spilled hot foods can cause burns. Do not pour hot liquids near patients. The water heater temperature should be set to no higher than 120 degrees Fahrenheit to prevent burns. Do not allow the use of space heaters. If used, they must be at least 3 feet away from items that can burn. Do not let a patient sleep with a heating pad. A poison is any substance harmful to the body when ingested, inhaled, injected, or absorbed through the skin. Poisoning can be intentional or unintentional. With intentional poisoning, the person takes or gives a substance to cause harm. With unintentional poisoning, the person takes or gives a substance without intending to cause harm. Poisoning can cause illness, brain damage, coma, and death. Some common poisons are drugs, both legal and illegal, vitamins, household products such as detergents, soaps, sprays, furniture polish, window cleaners, and bleach, personal care products such as soaps, shampoos, bath oils, and powders, fertilizers, lead, houseplants, wild mushrooms, alcohol, and carbon monoxide. To prevent poisoning, keep drugs and harmful products in high locked areas. This prevents confused persons and children from accessing them. Use prescription drugs correctly. Only take medications prescribed by a licensed healthcare professional. Take as prescribed. Do not share medications. Read and follow all directions and warning labels. Keep medication in their original bottles and containers. Buy products with child-resistant packaging. Leave the original label on harmful products. Read labels carefully before using a product. Do not mix cleaners together. Do not call drugs or vitamins candy. And supervise children when visiting family and friends. This is how to dispose of medication at home. These are some signs and symptoms of poisoning. Burns or redness around the mouth or lips. Burns, stains, or odors on the person, clothing, or around the person. Empty drug bottles or spilled medications. Vomiting, dyspnea, drowsiness, confusion, and seizures. These are some CNA interventions for poisoning. For poisoning in the eyes need to be rinsed with running water. For poisoning on the skin, clothing in contact with the poison needs to be removed and the skin rinsed with running water. If someone swallows a poison, do not leave the person. Do not have them try to vomit. Don't give them anything to eat or drink unless directed by a poison control center. And for an inhaled poison, you want to leave the area and get the person fresh air immediately. Lead is a metal that is found in all parts of the environment. It can injure the brain, nervous system, red blood cells, kidneys, liver, teeth, and bones. Lead enters the body through inhaling dust. Dust from soil may contain lead, and ingestion. So young children may eat, chew, or suck on non-food items that contain lead. Water is a source of lead if plumbing materials contain lead. Homes built before 1986 may have had lead pipes and fixtures that are corroded. House paint before 1978 may contain lead. Lead poisoning is the leading cause of learning and behavior problems. Some signs and symptoms of lead poisoning are abdominal pain, decreased activity, anemia, poor appetite, attention and learning problems, coma, poor coordination, fatigue, slowed growth, headaches, hearing loss, kidney damage, memory problems, slow reflexes, seizures, and vomiting. This graphic shows the different symptoms of lead poisoning. Carbon monoxide is a deadly, colorless, odorless, and tasteless gas. It's produced by burning fuel. Fuel burning devices must work correctly. Otherwise, dangerous levels of carbon monoxide can build up in closed or semi-closed areas. Instead of breathing in oxygen, the person breathes in air filled with carbon monoxide. Some safety measures include carbon monoxide alarms in sleeping areas in rooms with fireplaces, checking vehicle exhaust systems regularly inspecting chimneys, ventilating the room when using a space heater. Do not use gas grills indoors or in the garage. Don't use generators indoors. This picture shows sources of and some clues to a possible carbon monoxide problem. And then here are some examples of carbon monoxide sources. Some signs and symptoms of carbon monoxide poisoning include breathing problems, cherry pink skin, chest pain, confusion, dizziness, fainting, headache, nausea, sleepiness, slurred speech, vomiting, and weakness. Suffocation is when breathing stops due to lack of oxygen. Common causes include choking, inhaling gas or smoke, strangulation, and electric shock. To prevent suffocation, cut foods to small bite-sized pieces, make sure dentures fit properly and are in place, check the care plan for swallowing issues before serving a patient, follow aspiration precautions, and keep plastic bags away from children. Choking is also known as foreign body airway obstruction. It occurs when a foreign body, food, or an object obstructs the airway. The body doesn't get enough oxygen. Most childhood deaths from choking occur in children younger than 5 years old. Liquids are the most common cause in infants. Balloons, small objects, and foods are common causes in children. Weakness, dentures that fit poorly, dysphagia, and chronic illnesses are common causes of choking in older persons. Unconscious persons can choke. Common causes are aspiration of vomit and the tongue falling back in the airway. There are two types of choking. There's a mild airway obstruction, which is when some air moves in and out of the lungs. The person is conscious and can usually speak. You often see forceful coughing, which can remove the object, and their breathing may sound like wheezing between coughs. With a mild airway obstruction, you want to stay with the person, encourage the person to keep coughing to expel the object, and do not interrupt the person's efforts to clear the airway. With a severe airway obstruction, the person has difficulty breathing. Air does not move in and out of the lungs. The person may not be able to breathe, speak, or cough. The person may appear pale and cyanotic. This is an emergency. When choking, the conscious person usually clutches their throat. That's known as the universal sign of choking. To relieve choking, you do abdominal thrusts, which is also known as the Heimlich maneuver. Abdominal thrusts are used to relieve severe airway obstruction. Quick upward thrusts to the abdomen. The thrusts force air out of the lungs and create an artificial cough. They are done to try and expel the foreign body from the airway. Chest thrusts are used for obese or pregnant persons. If you are alone and choking, you perform self-administered abdominal thrusts. This is the hand positioning for an abdominal thrust. The fist is slightly above the navel in the midline of the abdomen, and the other hand clasps the fist. This picture shows abdominal thrusts with the person standing. This picture shows the head tilt chin lift, and it's a method that opens the airway. One hand is on the person's forehead. Pressure is applied to tilt the head back. The chin is lifted with the fingers of the other hand. And this picture shows how to relieve choking in an infant. You use back slaps. The infant is held face down and supported with one hand. The rescuer's forearm is supported on his or her thigh. Back slaps are given between the shoulder blades with the heel of one hand. After performing the back slaps, you do chest thrusts. This is when the infant is in the back lying position. The rescuer uses 2 fingers to compress the center of the chest just below the nipple line. An electrical shock is when an electrical current passes through the body. Electrical shocks can burn the skin, muscles, nerves, and other tissues. It can affect the heart and cause death. A ground carries leaking electricity to the earth and away from an electrical item. Without a ground, leaking electricity can be conducted to the person. It can cause electrical shock and sometimes death. Some warning signs of faulty electrical items include shocks, loss of power or power surges, dimming or flickering lights, sparks, sizzling or buzzing sounds, a burning odor, or loose plugs. 3-pronged plugs are used on all electrical items. 2 prongs carry the electrical current. The 3rd prong is to ground. A hazardous chemical is any chemical that is a physical or health hazard. Physical hazards can cause fires or explosions. Health hazards can cause cancer, affect blood cell formation, damage organs, and cause birth defects. The Hazard Communication Standard is an OSHA policy that requires labeling, safety data sheets, and employee training. The standard also requires eye wash and total body wash stations where hazardous chemicals are used. Hazard chemical containers have warning labels. The warning labels contain pictograms or symbols used to communicate specific information about a chemical hazard. Every hazardous chemical has a safety data sheet. It includes the following information: name and common names, hazards about the chemical ingredients, emergency measures, firefighting measures, accidental release measures, safe handling and storage measures, and personal protection measures. These are some pictograms from OSHA. Depending on the chemical, the warning label contains the necessary pictograms and associated hazards. There are 3 things needed for a fire to start: a spark or a flame, a material that will burn, and oxygen. When a patient is receiving oxygen therapy, no smoking signs should be placed on the door and near the bed. Smoking material should be removed from the room. Wool blankets and fabrics that cause static electricity should be removed. Lit candles, incense, and other open flames are not allowed. And materials that ignite easily, such as oil, grease, or nail polish remover, are removed from the room. RACE stands for rescue, alarm, confine, and extinguish. So R, rescue, you rescue persons in immediate danger. A, alarm, you sound the nearest fire alarm. C, confine, you close doors and windows to confine the fire. And E, extinguish, use a fire extinguisher on a small fire that is not spread to a larger area. To use a fire extinguisher, you pull the safety pin, you aim the hose at the base of the fire, you squeeze the top of the handle down, and you sweep back and forth. Risk management involves identifying and controlling risks and safety hazards affecting an agency. The goals of risk management are to protect staff, patients, agency property, and to prevent accidents and injuries. Risk managers are individuals who look for patterns and trends in incidents and complaints and accident and injury investigations. So color-coded wristbands are used to promote the person's safety and prevent harm. They quickly communicate an alert or warning, and the colors can vary by agency. A personal belongings list is a list of each item a patient has. The item is listed and described. The staff member and the person sign the completed list. A valuables envelope is used for jewelry and money. Each jewelry item is listed and described on the envelope. For example, a ring has a white stone with 4 prongs in a yellow setting. Do not assume that the stone is a diamond in a gold setting. Money must be counted in front of the patients, and putting items in this envelope must be witnessed. Dentures, eyeglasses, hearing aids, watches, some jewelry, and computers are kept at the bedside. These are also listed in the person's record. An incident is any event that has harmed or could harm a patient, visitor, resident, or staff member. Incidents include accidents, errors in care, broken or lost items, hazardous chemicals, and workplace violence situations. Incidents must be reported immediately via an incident report, and the incidents reports are reviewed by risk management.